So there are two kinds of injuries in sports medicine. The acute traumatic injuries, that's when somebody runs and trips and falls on their hand or their head. Those injuries sometimes just happen in competition. The much more common injury is called an overuse injury, and that happens when something starts to hurt over time. A great example is like shin splints. If you're getting pain, if it's changing the way you move, if it changes your mechanic of how you land, how you run, how you walk, you have to get that checked out before it becomes much more problematic.
The big factor is usually training. Once you've gotten to the Olympics, you've put in the time, and you're there for a few weeks, and there we tend to see more acute injuries. The overuse injuries usually develop kind of right around now, as you're building up and finishing your preparations, because really it's the amount of activity that you do that leads to the overuse injuries, and really it's the training where you see the most load through the body. They're working out in the gym every day, practicing every day.
Overuse injuries is a broad category which can affect joints, tendons, muscles. It's something that is essentially volume related, so how much of an activity somebody is doing, how often, how intense, and it's often directly related to how much rest they also have, so making sure that there's ample time for an athlete to rest and recover can avoid those injuries.
Common overuse injuries are things like Achilles tendonitis. The Achilles tendon gets sore and it starts to get inflamed over time. Shin splints, which can turn into a stress fracture in the shin or in the hip, and runner's knee, an irritation to the cartilage underneath the kneecap. We treat those injuries by figuring out, first of all, what the injury is. So we'll do things like get an x-ray and sometimes get an MRI, and then figure out why the injury is happening. Is it because their muscles are too tight, or because their feet are pronating or rolling in, or because their running stride is too long? We try and fix the reason why it's happening once we've figured out the cause.